Namaste and good afternoon. Happy to see you all again. Welcome to our Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and we are presenting special sessions this month exclusively focused on women's health. Lack of awareness, lack of authentic and reliable information, and fear of disease, I think, are the most important causes why people delay seeking treatment. It then gets too late to successfully treat diseases, even in situations where they could have been cured if detected and treated early. This is why we at Apollo Hospitals have commenced these live sessions so that you can hear from the top experts on what you need to be aware of. A perfect example of such a disease is cancer. We fervently wish that it doesn't happen to us or our loved ones. We tend to avoid what scares us, but what we need to do is actually just the opposite. With women, it's all even more concerning as we often tend to ignore our own health and always put other priorities ahead, which can be very unfortunate when it comes to cancer treatment. So, today, let us learn all about common cancers in women, what the risks and what the earliest signs are, what to do if diagnosed with it. And with these tools, it becomes a war that is much easier to win. To explain this concept and this topic to us in detail, I am delighted to welcome Dr. Rathna Devi. Dr. Rathna Devi is a senior consultant radiation oncology at Apollo Cancer Center, Chennai. She has over 33 years of experience in treating head and neck cancers, brain tumors, and other cancers affecting women. She completed her MBBS from the MS Ramaiah Medical College, Bangalore, and then her diploma in radiotherapy from Madras Medical College, and is also a member of the Indian Medical Association and is an expert in treating brain tumors, head and neck cancers, gynecological tumors, breast cancers, and many others. She has had further training in radiation oncology from Chicago, fellowship training in urogenital cancers from Chicago University, cyberknife training at Sunnyvale University, and is a mentor and tutor for the National Board trainees in radiation oncology. And she's received many awards, such as the M. Jagadisan Award for Young Radiation Oncologists from the state of Kerala. Welcome, Dr. Rathna Devi. Thank you so much for joining me in this session. And I look forward to discussing common cancers in women so that our viewers might be aware and alert about the earliest warning signs and what to do next.
Thank you for inviting me for this session. Good afternoon to all.
So let's begin, Dr. Rathna Devi, by first let's talk about what are the common cancers in women.
As you know, cancer is one of the commonest disease affecting, next to the cardiac disease, cardiovascular being the topmost, and second most common disease is cancer. Cancer can affect any part of the body from head to toe. Any part of the body can be affected. Among the female cancers, the most commonest cancers are the breast cancers and the gynecological malignancies. And of the gynecological malignancies, uterine cervix, uterus, ovarian cancer, vaginal cancer, vulval cancer. These are the 5 reproductive organ cancers that are common. Apart from that, what females do get affected and mostly not touched upon is head and neck malignancies, the oral malignancies, colorectal malignancies, even lung malignancies are also pretty common in our female population. So these are quite common cancers. Apart from that, anybody can get other cancers also, but these are quite commonly seen.
Do you think that the trend of cancers in women has now increased, or is it because of better awareness that they are coming forward for treatment earlier? What do you think?
The incidence of cancer is increasing year after year. as compared to 2020, 2021, the incidence was much more higher. And we are expecting more and more number of cancers affecting. And I can enumerate any number of reasons because of lifestyle, stress. The lifespan of each individual is also increasing. All these I can keep going on with the HPV virus and this and that for reasons why we see more and more incidents. Of course, what you said is also true. The awareness is definitely much more than what I used to see in the initial part of my career. People approaching us with the cancer, those days were more with the later stages like stage 3 and 4. As compared to now, we see people walking and asking for cancer screening. And we are detecting more early cancers also nowadays as compared to what it used to be. Definitely, media awareness programs are definitely making a change to the society. But this is more where we are seeing in the city. Still, I would say the rural population, the awareness is still at the lower side, and they seeking for help is comparatively low.
So, what are the earliest? I know that cancer, since it can affect any part of the body, it's a very broad topic. But what are the commonest, like warning symptoms of these? Some symptoms that one should not ignore.
Usually, there are few points which I would like to drive as warning signs. One is voice change, hoarseness of voice, which if it lasts for more than 2 weeks. A nagging cough, which is there associated with blood, and you are seeing it for more than 2 weeks or 3 weeks. Kindly seek attention. Bleeding or discharge from any orifices in the body. It can be in the breast, it can be in the vagina, it can be in the rectum, anything, any bleeding. Do not assume it can be because of piles or it can be because of wrong diet. Do not assume. If there is something, please do seek medical attention. Any lump anywhere in the body, it can be in the breast, it can be in the abdomen, wherever. If you are feeling any lump, that also in the axilla, especially with the ladies, I would say, oh, I didn't have anything. I just had a small lump in my axilla, but it didn't give me pain. This is commonly ignored. Please do not ignore such things. I'm not telling it is cancer, but it could be cancer. And who's the best judge to tell you that is the doctor. So any symptom like cough or hoarseness of voice, discharge, lump, an unexplained block of ear. You do not know why, but there can be an unexplained block of ear, a foreign body sensation in the throat. All these also are warning signs of cancer. Any change in the mole or any unhealing ulcer, all these also needs medical attention because it could be a warning sign for cancer.
So, in some people, there are no warning signs at all. So, which is why we emphasize the requirement of annual screening so that even if there are no symptoms, these cancers can be detected. So, could you tell us what are these screening tests and also age appropriately? How should one go about having them?
That's a very, very important question. Thanks for asking that. Because screening, many people are not aware of. All of us are interested in knowing whether I have a sugar. Whether I'm diabetic, I would check my blood sugar. Whether I'm hypertensive, I would check my BP. But nobody wants to check, or they think I won't have, I've not done anything wrong. Why would I get a cancer? Things like that, these kind of beliefs are even at present, it is there. So the cancer screening program is a set of tests where you are checking in a normal individual. There is no particular symptom for which you go to the doctor. You go to the doctor asking whether everything is okay for me from the cancer aspect. That is cancer screening. So there is a set of tests which we are trying to see whether the common cancers, whether we can, there are certain detectable common cancers which are with very simple tests we can detect. For example, oral malignancies, laryngeal or something in the hypopharynx with an ideal scopy we can see. By inspection of the skin, you can see. then breast examination, mammogram, ultrasound abdomen, chest x-ray. If there is any colorectal, you get an opportunity to talk to the doctor. And if there is a bleeding for rectum, and if it warrants for a colonoscopy, yes, you get it done. So these are the tests. And when it comes to male, there is a PSA test, which is a very sensitive tumor marker for prostate cancer, pap smear in case of a cervical malignancy. All these are very important tests, which is part of the program. And this is recommended yearly once above the age of 40. Especially if you are a smoker, if you are an alcoholic, these are the people who have to pay attention. As you know, smoking, like in a cigarette, we all know it has got nicotine only. But there are more than 3,600 chemicals or unwanted chemicals has been identified in a cigarette, and that can cause any number of problem in the health. So a smoking, be it an active smoking or a passive smoking, yes, these people need to pay attention. And these are the candidates who should come for regular screening.
So that again brings us to the next point, which is the risk factors. So what kind of risk factors do women have for certain cancers?
If you see, women are mostly affected by breast cancer, cervical cancer. I also told oral malignancies and lung and esophageal cancers, colorectal cancers. All these cancers are pretty common. So who are the people who are at risk? First of all, when you come into the head and neck cancer or the lung cancer, it is smoking. Smoking tobacco in any form. It can be chewing of tobacco, it can be a cigar or a cigarette or BD smoking. Any of these can affect these parts of the body. Smoking can also cause carcinoma of the urinary bladder, not just your head and neck and lung, even bladder cancer is pretty common in smokers. Smoking also has an influence on the cervical malignancy. So smoking foremost is an important factor which can have all these areas affected. Other areas, risk factors, when I can split and tell you, when since we are talking more on the female malignancy, with the breast cancer, age is a factor. As advancing age, as we advance with the age, the risk of developing cancer also increases. Hereditary factor is also there in the breast cancer. BRCA1 and 2 is an inherited gene mutated gene if it is there. Breast cancer, ovarian cancer, uterine cancer, all these cancers are hormone related. Obesity. When you are obese, the fat cells also produce estrogen, which can again cause as a risk factor for these people. Early menarche, late menopause, because that lady is exposed to a large amount of hormones, they also come under risk factor. When it comes to the uterine cervix, early marriage, that is before the age of 18 or 17 when they get married, they have the opportunity to go into sexual intercourse much earlier. Because of that, the sperma-columnar junction, which is low-lying at that age, gets completely bruised again and again, and they can develop cancer in the future. Human papilloma virus, again, is a risk factor for cervical malignancy. Multiparity, more number of children, also is a cause for cervical cancer. And multiple sexual partners are also a cause. Lifestyle, poor genital hygiene, a poor diet, sedentary lifestyle, stress. Stress is also a factor which can be contributing for the health of the breast also. So there are multiple risk factors which can affect, like certain risk factors are more for the breast cancer, and certain risk factors like HPV virus and all is more for the uterine cervical cancer. So these are the various risk factors I could think of.
Right. What about the lifestyle modification? Because some of these are modifiable risk factors. So in the realm of lifestyle modification, what do you think women should do to at least, whatever is in their hands, what can be prevented?
Yeah, when we are talking about lifestyle, like most of us are working women and we lead a sedentary lifestyle. That is one of the life risk factor. Number two, stress. lack of exercise, not a proper balanced diet. So either you are constantly dieting to keep a watch on your health, or you are binge eating because you as a stress buster. Okay, from morning I was stressed, I was in the work, I was with this meeting, that meeting, and then you go home, you feel like a stress busting, eat whatever you can get grabbed into your hand, and then that makes you happy, so you eat. So these are the things which we should avoid. Exercise, statistically proven, 50% of the breast cancer can be avoided with regular exercise. Regular exercise not only keeps the body weight under control, thereby obesity we can overcome, also it releases happy hormones so that the stress part of it is gone. So these are little life modifications we can consider. And sitting for a long time in the chair, even you are a sedentary worker, make an effort to get up, walk, and then come back, drink adequate water, take proper salads, and take proper nutrition. Like antioxidants are abundance in our day-to-day food. Vitamin A, C, all that are there in all green leafy vegetables, colored fruits and vegetables. All this can be added into your diet.
Absolutely. So now I think we will talk specifically about a couple of cancers in a bit detail. I would like to first, we already said a little bit about cervical cancer, but what about endometrial cancer? So, not much is spoken about endometrial and ovarian cancer, so I thought we can discuss that in a little bit detail. So, what first about endometrial cancer? So, could you tell us how exactly this happens, and what would be the early symptoms to take medical treatment?
Endometrial cancer, you can equate it with that of the breast cancer. This is also hormone dependent cancer, usually comes at a later age, postmenopausal age. That is the age group which gets affected by this cancer. Again, obesity makes a big contributing factor for this cancer. Obesity, hypertension, diabetes, all these are contributory for the endometrial health. Usually, patient presents with a postmenopausal bleeding. After your menopause, cessation of periods is called menopause. When you have a postmenopausal bleeding, maybe it will be very light. So what generally patients do, oh, I had a little bit, suddenly the periods came, but that then went off. So they just ignore it. And the cancer keeps growing and growing. And then when there is a torrential bleeding or something, or a back pain, or when they have that bloating kind of sensation, only then they approach the doctor. Maybe the cancer has invaded not only into the endometrium, it has gone into the muscular layer and the serosa. Probably the stage migration has happened. So this is one of the, this is also very common, more with the Western population. But it is a very common, endometrial cancer is also pretty common. And if detected early, completely curable. And mainstay of the treatment will be surgery, followed by the adjuvant treatment.
One has heard that, ovarian cancers are one of the most ignored. I mean, in the sense that, they hardly show any symptoms until they're at a very late stage. So what would be the earliest warning symptoms, or what kind of screening can be done in that case to screen yourself against ovarian cancer?
Screening program, you do have an ultrasound abdomen screening. Maybe that can throw some light on these ovarian.
Okay.
An advanced cancer screening program where they do the tumor marker PA125. So not very, very specific. Yeah, it throws more light for it. And the symptoms here, as you said, it is generally not shown, and only when the patient gets a little heavy pain, or more of that symptoms, when it becomes really symptomatic, that's when the patient approaches the doctor. Yes, we do see like that, whether it's ascites, they sometimes present, they present with severe pain. These are the type how they present. So to some extent, the cancer screening regularly can detect even this at a pretty much early.
But what about people also have things like endometriosis and ovarian cysts? So how does one differentiate between a benign ovarian cyst as opposed to, even with endometrial cancers, there are so many conditions like DUB or fibroids, which can also lead to a lot of heavy bleeding and pain and all that. So, how does one differentiate between these conditions?
We have very specific tests and how to differentiate whether it is a DUB or an endometrial cancer or an endometriosis, or whether it is an ovarian cyst, which can be simple or functional cyst, or it is cancer. So these cysts are benign conditions. There's nothing to really panicky about it. If your gynecologist says you have an ovarian cyst, see, the follicles in the ovary itself is like a cyst. So, which is supposed to be releasing your ova during each menstrual cycle, and then the cyst goes away. Sometimes the cyst stays back. They are the ones which produce estrogen and progesterone, and once your ovum comes out during your regular menstrual cycle, the cyst also goes away. Sometimes when they stay back, we call that as a cyst. It is like filled with fluid. That's all. The follicles are filled with the fluid. This is nothing to do with the cancer. It doesn't. It's either we call it as a simple cyst or a functional cyst. This may even be for a longer time. Only when the cyst becomes a little larger, like over 4 centimeters or so, the gynecologist usually tell, let's go ahead and remove it, and that kind of advice. But a cyst, you really needn't have to panicky and think about a cancer. With the endometriosis, also a similar way, I would say. This has got nothing to do with the endometrial cancer. With an ultrasound in a postmenopausal lady, there is a certain thickness of endometrium, which the ultrasoundologists know. Like, this is the thick. When it becomes a little more, which is not supposed to be, then we can get a biopsy done or a fractional curettage to be done. The gynecologist can help you, or the oncologist will help you to check out whether it needs more attention.
So the underlying message for all of this is really, I think, that seek medical help in doubt whenever you have a doubt, so that you don't have to unnecessarily also be fearing that it is cancer. At the same time, if it is, then it can be treated and even cured very early. So that is really the key of this whole discussion, I think. We will just have a little bit of, because today the world of diagnostic modalities has really, like, technology has grown by leaps and bounds, and of course even the treatment modalities. So let's first discuss just an overview just on what is the latest in terms of, like, what kind of strides have we made in cancer diagnosis.
Cancer diagnosis, we have radiology, the lab, the molecular studies, everything as compared to 20 years back. What we had and what we are having now is so good. It is that the science has grown really, really well as far as the technology, and at Apollo we have the best of all these technologies available. Our pathol labs are good. Frozen section we do. Frozen section is while the patient is being operated on the table, and you want to check out whether the lymph nodes of the breast, for example, for a breast cancer, and you want to check out whether that particular lymph node is affected by the cancer, you send for the pathologist. They do the frozen section and tell you, which facilitates minimal surgery. So all these are wonderful technologies which we didn't have. Sentinel lymph node mapping, the kind of colorectal with a robotic surgery, and there is the technology is simply superb these days. And as you said, with the radiology, you have like PET scan. PET scan is a real breakthrough, I would say. In if it is prostate, you have a different kind of isotope you give. It is so specific for the prostate, and it checks out where all this cancer is spread. If it is going to be another cancer, whatever you want, FDG, particular glucose stacked one, then we use that isotope. So nuclear medicine plus the radiology, together we have the SPECT CT, which is a very beautiful tool. Plus, interventional radiology is again another plus I would talk, which is really, really good in many aspects. Now we get the biopsies done very beautifully by the interventional radiologist, minimal invasive, where otherwise you would have gone for an open biopsy. Laparoscopic biopsies, That also is a keyhole. Very simple, small procedure where you go get the correct hit on the target and get the tissue diagnosis. Tissue diagnosis is very, very important as far as oncology is concerned. And tissue diagnosis itself, we have many more in that. Like not only whether we are only confirming the cancer, not only on the grade, but we are having so many molecular, we call that immunohistochemistry, molecular things which we see that, and that helps in our treatment also. Very targeted therapy we can give based on all these information given by the investigation modality.
And regarding the treatments itself, I mean, there again is one area where things have been changing and are still changing rapidly. So, would you like to tell our viewers one or two of these amazing new modalities that are available for treatment of cancer?
When oncology is concerned,
It's a huge topic, but just to give them a view that it's
small information. Surgical oncology, medical oncology, radiation oncology is the three main groups of treatment modalities of any cancer. When you come to the surgical oncology, that is removal of the cancer by means of operation is surgical oncology. How you remove? Now it used to be only open surgeries. Now you have laparoscopic surgery, robo-assisted surgery, like in deep pelvic tumors. Like the surgeons, when the tumor is situated deep into the pelvis, surgeon's hand cannot go 360 degrees to turn his hand. That much only the surgeon's hand can move. But with robotic surgery, they are able to do much more heroic surgeries, which was not possible those days. Now it's been possible. Surgical oncology is grown so beautifully. Coming to the medical oncology, yes, we had, of course, you very well know platinum was a real breakthrough in the medical oncology. But after that, so many more has happened, immunotherapy, targeted therapy. So the growth in medical oncology, which all we thought we couldn't treat those days, now we are able to do that. Even in a little metastatic disease, when we call stage 4 disease. Now, whenever there is an oligometastasis, we still attempt cure for those patients. It's not like now stage 4, we can't do anything, it's only palliative. It's not anymore like that. It depends upon what cancer, how many metastasis. Oligo means less number of metastasis. A patient who's having one single metastasis in the brain, even though it is stage 4, we can still do a lot more for this patient than what we were doing before. With my department, that is radiation oncology, from cobalt, we are now into the era of proton. The evolution has been simply superb, and I have been one of the lucky person who have seen those days treatment and the present day treatment, and I'm really happy I'm able to treat things. From cobalt, we moved on to linear accelerator. From 2D technology, we moved to 3D technology, intensity modulated radiotherapy, then image guided radiotherapy. Then we moved into the radiosurgery, like cyberknife. From gamma knife, we moved on to cyberknife, and then now to the even more beautiful technology like proton technology. So the journey has been very beautiful. And I mentioned about one single metastasis. I recently had a patient who's a young man. He was about 37 years old, and he had a bad parotid tumor. It was a little locally advanced, and wonderful surgery was done for him, and we finished the adjuvant treatment in chemotherapy, radiotherapy. Very, very rare presentation. He presented with a tiny, small, single metastasis in the brain. We went ahead, we operated, we did a proton therapy, and patient is back to normal, doing all his day-to-day work. In the past, this was the scenario, this wouldn't have been a possibility. Now it is a possibility. That is what I'm trying to tell. The recurrence, re-radiation, how many, we didn't even think of doing radiation in the past, re-radiation in the past, because once tissues are irradiated, they don't forget the radiation. So re-radiation was not a possibility those days. Now re-radiation is very much possible. We are doing so many, the technology is available. Cyberknife is one such equipment, proton is one such equipment where we can think of re-radiation. And liver, we never even thought, moving organ. Liver is a moving organ and radiation is a static beam of rays which comes. So in the moving organ, we cannot use something which is static. I hope I am clear. See, something is static. So we found that is when the cyberknife came, where with this robotic, the linear accelerator is attached to a robotic arm and it can see the tumor moving, it can move along, automatically corrects according to the movement of the tumor. So that is a beautiful technology where we can make use of real-time imaging with the proton therapy, also made it possible to treat such precision. So precise a technique is we don't do anything outside that field. Like if the tumor is this, we treat only that. The rest of the normal tissue will be completely protected. So these are amazing technologies which has made oncology. It is not anymore like it's a killer disease. I wouldn't say anything like that. Even with a little advanced in certain cases, it's really, really being beneficial.
That's wonderful to hear. So thank you, Dr. Rathna Devi. So dear viewers, now I hope you've had a very informative session on cancer. And I think the word cancer should not now anymore make you anxious or scare you. Instead, you be alert to your body, attuned to it. Take full advantage of all the amazing advances which are there in medical technology and medicine to screen yourself, to understand your risks. And remember that the earlier you find out and the earlier you take medical advice, the better the chances are that you can conquer cancer. So till we meet again next, stay safe and healthy and reach out to us anytime on all our social media channels. We're always there to help you. Thank you and namaste.